Thank you very much for giving me this opportunity. So my name is Yasser Khan. I'm an eye surgeon and eye plastic surgeon, and I was in Gaza, to be honest. Exactly a year ago, right now, I was in Gaza in December and January of 2023, 2024. Only 3 months after this war and genocide, and I went again in March, 2 months later. And even in the 3 months when I first went to Gaza a year ago, and then 5 months after, the conditions were horrible. And the things that I've seen that I think many of us have seen were horrific. Nasser Hospital in March was already destroyed, evacuated, closed down, patients left behind, dead bodies deteriorating in the hospital. That was already there when I went. I work at the European Gaza hospital, which was the only hospital that was really open, that was full service at the time, with with all the services and surgical ORs going on where I did my surgeries, but the indiscriminate attacks were still occurring. And so, as an eyewitness to this genocide, I come to this from more from moral, ethical, and philosophical angle, in addition to what my wonderful colleagues have said. I mean, the systematic targeting of the healthcare workers in Gaza by the Israeli government is a violation of humanitarian principles, international law, and just basic human decency. I mean, the attack on Kamal Adwan Hospital and all hospitals, virtually all hospitals, and the kidnapping of healthcare workers, abduction, killing, including Dr. Hussam, are glaring examples of the atrocities that have been committed against a system meant to save lives and not take them. I mean, healthcare workers in general, I mean, we have to emphasize to everybody around the world, are not combatants. We're protectors of life, right? I mean, we treat the injured, we care for the most vulnerable, we uphold principles of neutrality in medicine. We save lives regardless of political or military affiliations. I mean, that's what we do. And detaining us or the healthcare workers specifically in Palestine is a direct attack on humanity, on the very essence of humanity. Now, this is not just a moral failure, but a violation of international law. As you know, Article 18 of the Fourth Geneva Convention explicitly mandates the protection of medical personnel. Their detention is a war crime, and these actions erode our global commitments to the sanctity of humanitarian work. As a lifetime humanitarian, this concerns me because it affects everything going forward, every humanitarian effort going forward. The consequences are catastrophic. By disrupting medical care, these acts already push an already destroyed healthcare system beyond collapse, and you'll get thousands of more deaths and widespread suffering, as is going on in northern Gaza and everywhere else. And the Lancet estimated almost 200,000 dead 3 or 4 months ago. Dr. Hassan Abu Sita recently said that there's at least 300,000 people that have died already, and this does not include the wounded, which is a death sentence. So the numbers are huge, right? And I think those of us that have been on the ground know that 300,000 people dead is not an unreasonable number or estimate. At the core of these actions lies a profound ethical failure. I mean, detaining those of us, the healthcare workers who risk their lives to save others, really betrays the principles of humanity and compassion. I mean, they have dedicated their lives to preserving life no matter what. And those of us who've seen the Palestinian healthcare workers, they're all heroes. They work tirelessly 24 hours a day. So, I mean, failing to protect medical professionals, I think, sets a very dangerous precedent internationally. Undermining global norms, inviting further violations of humanitarian principles, all is just a very, very dangerous precedent to set. And I think the international community cannot remain silent, and we must act decisively. Finally, I'll end off with this. I mean, the suffering caused by these actions is not confined to the present, right? We all know that the long-term psychological trauma that has been inflicted on Palestinians, women, children, men in Gaza will ripple through generations. Denying access to healthcare in times of conflict, and especially here, deepens these wounds. And I mean, we'll be dealing with a nation with a people that are scarred and will be dependent on international aid for a lifetime. So I mean, I basically I ask for I think our ask is really 3 points, right? And I mean, when it comes to healthcare, I'm going to simplify and end with this. Is really 3 points. One is, of course, to stop this war and genocide and cease fire immediately, but also releasing all the detained healthcare professionals, which number in the thousands, including Dr. Hussam, and ending attacks on the healthcare infrastructure, which includes clinics and hospitals. This is not just a legal obligation, it's a moral duty. It will be a step towards alleviating suffering and restoring dignity to the people in Gaza. And I think as a world, as humanity, we can't look away from this. And I think many of us are eyewitnesses here. And I think we all have to keep this going, keep these efforts, keep these webinars, these press conferences, this advocacy going until this is over and beyond.